Hello, my name is Lakaya Campbell, and my group will be doing a short film on HPV and Gardasil. My part in this short film, I will be playing the HPV patient.
Hello, my name is Jasmine Brown, and I will be playing the part of the supportive friend.
Hello, my name is Melanie Watson, and I'll be playing the doctor in this short film.
Hello, my name is Shanae Tillman, and I play supportive friend number 2 in this short film.
Hello, my name is Lakaya Campbell, and I was recently diagnosed with HPV. This is my story. Listen up, and please be aware.
Goodness, it's gonna be okay. It's alright. Kaya, why are you crying? What's wrong?
Something isn't right with me.
What's wrong? Did you get hurt?
No, something's wrong with my body.
What's wrong with your body?
Recently, I found small bumps growing on my skin. I don't know where they came from.
Were you having unprotected sex?
I've had unprotected sex. Would that be a reason for, bumps to be on me?
Do you think it could be like herpes or something?
I hope not.
I hope not either. I mean, we can go take you to get tested.
Do you know anybody?
Yeah, I know Dr. Watson. She's really good.
Is it confidential?
Yeah, everything's confidential. We can take you, if you want us in the room, we can be in the room. If you want us to get out, we can leave you. It'll be just you and her, and everything is kept between you and her.
Okay, I think we should go see her.
Okay, let's go get you some tests for my girl.
Thanks, guys.
No problem.
We got your results back in the practice and we confirmed that you had HPV, but I brought a pamphlet for you to read, and you can ask me any questions that you have about the disease while we're here. Yes.
What is HPV?
HPV is a common virus. There are about 40 types that can affect men and women. Their genitals, they can cause genital warts, and other types can cause cervical cancer.
Well, how did I do it?
You can't really pinpoint where you got it from because many people are asymptomatic. So you could have got it from having unprotected sex with a partner who had once had intercourse with someone who was infected with it or anything like that.
Are there any treatments for HPV?
There aren't currently any treatments for HPV itself, but there are treatments for the things that it causes, like the genital warts.
Will I have this forever?
It's not very likely that you will, because it usually clears up within 2 years of having it. Your body will fight it off, but in some cases it does last longer, maybe for a lifetime.
So how do I prevent from passing this to my partner?
The best way to prevent passing to your partner would be to not have sex with him, but if you do engage in sex, then you should wear a condom because that lowers your risk.
So can my partner come and get tested?
There aren't currently any tests for men to detect the disease, so no, you can't.
So how likely am I to get cancer from HPV?
You're not very likely. Very few women who have HPV end up developing cervical cancer. If you go by what I tell you and you come in so we can keep checking your cervix and for the abnormal cells, and you just comply with everything that I tell you, then you should be okay.
Okay. Well, thank you, doctor.
No problem.
Approximately 20 million people are currently infected with the human papillomavirus. At least 50% of sexually active men and women acquire genital HPV infections at some point in their lives. By age 50, at least 80% of women will have acquired genital HPV infections. So what is HPV? There are over 40 types of HPV. They are referred to as papillomaviruses because certain types may cause warts or papillomas, which are benign tumors. HPV can be divided into 2 groups, high risk and low risk. They are grouped based on whether or not it increases an individual's risk of developing cancer. Low-risk HPV types are wart-causing, while high-risk types are cancer-causing.
Causes and symptoms of HPV. Prevention. Get facts. Teach and inform yourself about information concerning HPV. How does this disease spread? How can I protect myself? What are some of the ways that I can get treated? You can go on to Disease Main website and read the STD fact sheet on HPV on cdc.com or .gov. You take control. You're in control. You have the facts, now protect yourself and your sexual partners. Effective ways for reducing HPV risks include abstinence. The most reliable way to avoid infection is to not have sex. Vaccination. Vaccines are safe, effective, and recommended ways to prevent HPV. HPV vaccines for males and females can protect against some of the most common types of HPV. It is the best way to get all 3 shots before becoming sexually active. Reduce number of sexual partners. Reducing your number of sex partners and disease can decrease your risk of HPV. It is still important that you and your partner get tested and that you guys share your test results with one another. Condoms. Correct and consistent use of the male latex condom is highly effective in reducing HPV transmission. Use a condom every time you have anal, vaginal, or oral sex. Transmitted. How HPV is transmitted. HPV lives in the body's epithelial cells. These are flat and thin cells found on the skin surface and also on the surface of the vagina, anus, vulva, cervix, penis head, mouth, and throat. The HPV virus are spread through contact with infected genital skin, mucous membranes, or bodily fluids and can be passed through intercourse and oral sex.
I will be discussing the history of infections caused by HPV. Genital warts and cervical cancer are the main 2 health problems. Genital cancers and RRP are not as common. Genital warts are known to be small bumps on a genital area. Genital warts are mostly shaped like cauliflowers. These warts are usually the same color as the skin, and they are harmless but irritating. They appear 6 weeks to 6 months after infected. These warts cannot be seen by the naked eye. Doctors can diagnose warts by examining the skin closely and using a special solution to make them easier to see. About 360,000 people in the U.S. get warts each year. Cervical cancer is a cancer located on the cervix. Cervical cancer occurs when abnormal cells on the cervix grow out of control. The symptoms of cervical cancer is bleeding from the vagina or a change in your menstrual cycle, pain during sex, or vaginal discharge. This cancer is common among middle-aged women and women who started intercourse at an early age. The treatment for most stages of cervical cancer includes hysterectomy, chemotherapy, and radiation therapy. RRP is an infection that grows warts in the throat of a victim. This condition is very rare. RRP can cause voice change and it can block the airway, causing trouble breathing. Gardasil is the only human papillomavirus vaccine that helps protect against 4 types of HPV. In girls and young women ages 9 to 26, Gardasil helps protect against 2 types of HPV that cause about 75% of cervical cancer cases, and 2 more types that cause about 90% of genital warts cases. In boys and young men ages 9 to 26, Gardasil helps protect against approximately 90% of genital warts cases. Gardasil also helps protect girls and young women ages 9 to 26 against approximately 70% of vaginal cancer cases and up to 50% of vulvar cancer cases. Gardasil may not fully protect everyone, nor will it protect against diseases caused by other HPV types or against diseases not caused by HPV. Gardasil does not prevent all types of cervical cancer, so it's important for women to continue routine cervical cancer screenings. Gardasil does not treat cancer or genital warts and should be given as 3 injections over 6 months. Completing the series of 3 doses is the only way to get the full benefit of Gardasil. Gardasil should be administered in 3 separate intramuscular injections in the deltoid region of the upper arm or in the higher anterior lateral area of the thigh. Individuals are encouraged to adhere to the 0, 2, and 6 month vaccination schedule, which means get the first dose, then 2 months after the first dose, have the second dose, and 6 months after the first dose, have the third dose.
Thanks for watching our short film.
I hope you learned a lot of new information on HPV.
If you know anyone at risk, we hope that you pass this along and help them.
Thanks. Have a nice day.
Bye.
Bye.